I'm looking for a motion on the minutes of our July 29th meeting.
Also
Moved by Mindy,
Second.
seconded by Abby. Any other discussion? All those in favor?
Aye.
Aye. Motion passes. Any additions to the agenda?
I had a question on the agenda. So at the bottom, it says the next Board of Trustees meeting is September 30th at 8 a.m. Is that correct? Okay.
Sorry about that.
That's okay. I just noticed that, so I just was going to mention that. It says 8 a.m. So
Yeah, that's too early for me.
And was it moved to the 30th? Is that what you said?
well, they have it at 8
Wednesday
a.m.
of the month would be the 30th.
Yeah,
Okay,
but they
okay.
have, she has it at 8 a.m. and it should be 2:30.
Yeah.
That's
I
unique
thought I was-
because you might have thought the 23rd.
I was thinking the 23rd, and I was afraid I was going to have another conflict,
Oh.
but if it's the 30th, that's great.
30th at 2:30 then, right?
Yeah.
Okay.
Yeah, sorry about that.
No, that's okay. So I think that's the only thing I saw on the agenda, so.
And where did you see that on the agenda?
So it's at the very bottom, it says the next meetings, next Board of Trustees.
Oh, there it
meeting.
is. Okay. Yeah, I didn't catch that, right? Okay, with that correction, need a motion to approve the agenda as is,
So moved.
as amended.
As amended, second.
Moved by Abby. Seconded by Mindy. Any further discussion? All those in favor?
Aye.
Any opposed? We have some recognition. Are you handling that, Sadie?
Me or Mike?
Or is this
Scott.
Mike or
Mike nominated. Oh, Scott.
Scott's handling it? We'll turn some time to Scott then for recognition of our revenue cycle director, Sarah.
Members of the board, chairman, today I'd like to recognize a very special person that has been recognized outside of our organization in the last 30 days. The Healthcare Cooperative noticed and recognized Sarah Merritt for the cooperative's Revenue Cycle Director of the Year Award of Excellence. She was nominated anonymously. Here's what they said about her nomination. But before I say this, I'll just let you know that I had a discussion with her today regarding her performance of about last year. We reminisced about the last 3.5 years we've known each other. And of course, I worked with her. She's demonstrated a lot of resilience in the face of very monumental challenges we've had since the days of Epic and Change Healthcare, and Epic again, and more recently the challenges of our payer mix, margin compression, et cetera, et cetera. She seems to just handle it in stride. She has, I told her today, she has self-improvement in her DNA. She always is seeking to improve herself and performance, her team, and that is a big role of it. But somebody nominated her at the cooperatives level and said this: Sarah's commitment to improving the days in AR, days to file insurance claims, and improvements in cash collections have been nothing short of miraculous during the year. Sarah instills excellence in her team, and their work exemplifies her leadership, collaboration, commitment, and respect for the revenue cycle process. Her contributions are invaluable for the success of Star Valley Health. They said, finally, you are such a shining star in your organization and in our organization. We love you and your commitment to the patients and employees of Star Valley Health. But it's recognized Sarah for that great achievement.
Sarah, was it? You have, she's already been awarded an award, I guess.
Yeah, that's good now. So they
Oh.
gave me a minute.
Oh, cool.
And we have a photo there.
Oh, a calculator.
Yeah, they want a photo.
Kind of an old style calculator.
Well, she said, say, make sure
Quirky
you
enough, I like it.
pay your bills on time.
Thanks for all you do.
Thank you.
I appreciate it. Thanks.
Thank you.
You get it, Dan? All right. Appreciate you coming. So I guess that little medallion is what a true bean counter gets, right?
She counts bills.
Bills, okay. All right. Chief of Staff, I saw him hanging around. Is he, there he is. Not much left of you there, Doc.
It happens. Hey, a couple of things. I wanted to bring up an interesting thing happened yesterday. I was flying down to Dallas to see my son. I hadn't seen him in a long time, and he's down there doing a transplant surgery rotation at Baylor. And news broke as we were flying about Dolly Parton passing. And the comments, you know, I mean, ATC, air traffic control, I mean, it's typically, even these are the airliners, they're, you know, it's very professional. But they were just random comments for the next 3 hours, you know, intermittently about Dolly. It was really interesting. And as I waited for my son in the lobby, nothing but Dolly saw overhead. And he said he was in a kidney transplant. The nurse let it, you know, told everybody that Dolly, you know, news broke that Dolly passed, and every OR started to play Dolly songs, you know. And it got me thinking, you know, she obviously influenced a lot of people's lives for good. But did she really appreciate the impact that she had? You know, I don't know, but that can be said for a lot of others, and particularly in our medical staff. And I wanted to just bring up, let the board know, particularly one award that is being presented to one of our physicians, Dr. Kurt Stock. He's been coming up here since the 90s, providing ENT services, and I don't think I could give a bigger compliment than he's a gentleman surgeon and an amazing colleague. But the Utah Medical Association is awarding him the Physician of the Year award.
Wow. That's cool.
Yeah, so it'd be worth reaching out and congratulating him. It's a big deal. Well deserved. He's earned it, obviously. And I worry that the community, and to some extent maybe even our employees here at Sarvelli Health, you know, I've said it a lot lately, but the definition of an expert, somebody from out of town, you know, and I'm not sure we appreciate who we have here. And Kurt is certainly well deserving of that. And you know, did Dolly know that she affected so many people? I don't know. You know, do our physicians know? Or others? Yeah, I don't know. So.
No, Kurt is also an original Star Valley, I think so.
He is.
Grew up down on Neal Street.
Uh-huh.
Well, no, actually in the town. His parents moved out of Neal Street, sorry.
Yeah.
Yeah.
So anyway, that's it.
Thank you.
Thanks, Doc. Thank you. Anybody on the consent agenda? We have anything to pull out and discuss? Any questions? I think we'll have a report for our finance committee. We can also ask questions on. Anything specific you want to pull out of our consent agenda to discuss? Okay. Or the bills against the district? Any questions? And I'm looking for a motion to approve the consent agenda. Going once. Moved by Jeff,
Second.
seconded by Mindy. Any further discussion? All those in favor of the consent agenda?
Aye.
Any opposed? Passes. I assume, Cole, you're doing the report on the finance committee? Sure. Great. We'll give you time now.
Okay, great. So, Finance Committee, we met August 17th, reviewed and approved minutes from the previous meeting. Scott presented the financial reports as included in the packet. Some of the highlights of the financial reports this meeting included a very strong month that we had in July to start the fiscal year. Some of the results that we were talking about, some of the highlights in there was a $2.1 million stronger net revenue than planned, $2.4 million stronger than the previous year. Operating expenses, I guess the significance of that was that the operating expenses actually held consistent with the plan. So not only did we see a significant increase in revenue, but we also seen operating expenses stay steady and consistent with the plan, which obviously led to the bottom line strong net income of $2.3 million for the month, which also led to increased AR. Days cash on hand as of the end of July set just about 31. At the time of the meeting, we were seeing about 34. That uptake a little bit in August due to collection efforts. We did have some discussion on potential working capital note through Optum. The audit, we did comments on the audit. It was going well. The on-site visit was done. Punch list this year when they left was much smaller than previous years. So it sounded like we were doing much better this year. And if I didn't mistake it, we should see something in September on that, right, Scott?
Yeah, the ultimate report to the board would be in the October meeting. In the past regular years, the next meeting will ahead of final getting the draft or whatever into the bank.
Yeah, so you'll see a draft by September, probably.
September.
The cost report amendment for fiscal year 2024 is still in process, as well as the audit for the fiscal year cost report in 2023. My understanding is we've supplied everything. Now it's kind of a hurry up and wait situation. We also, Mike gave us an update on the rural healthcare transformation program, which I'm sure there's probably more updates since this one, but basically that we were approved for $2.2 million related to EMS, $2.5 million hospital related for a combination of 4.7. There was some further stipulations and you can read those in the minutes as we go. And so a number of things we don't know yet, we're still learning, but obviously we'll learn more about those as we go. With that, that's really what I have for the report.
Okay, any questions? Abby? Quality committee?
So no questions.
Oh, no questions? And I'm moving on
Cool. Now
to yours.
Yeah, quality report. Just to start, the Good Catch Award, you guys are familiar with that. It's when we take some incident reports and we kind of decide which one made the most impact on the organization, preventing medical emergencies or changing the way that we do things or catching errors before they happen. And are finding that there's so many high quality reports happening that we are going to switch that from a quarterly report to a monthly report, maybe announcing them on a quarterly basis. That's neither here nor there, but recognizing these great efforts by so many people in the organization to prevent problems from happening, really getting ahead of things. So pretty unanimous decision to do that. And I would say you guys all had a chance to read the notes. Everybody's excelling, doing well, hitting their metrics, and looking at high quality metrics to meet the bar or exceed the bar. I think pretty much across the board that happens all the time. We did have some requests from EMS. Sherry came and reported, because we're dealing with a lot of issues surrounding EMS. We like the reports they're giving us. It's better information than we've ever had, but we're kind of trying to see, be a little bit more clear on when we hit status zero, what those exact incidents look like. It's going to require more pulling things out of the reports, and it's way more tedious, and so we knew we were asking for a lot, but I think it's going to be valuable. And then when we're like close to status zero, like maybe how long we were out of it. What questions did we ask her to focus on?
I think it was more just like minutes.
A minutes thing, yeah. Not just that it's an event, but like how long were we out of? And we know, I think we've got track of when an ambulance comes back in, they have to get reset and turned around. They're supposed to be saying, I'm not available for service, and then clock back in quickly. That might have been responsible for some of that time out of service, but I think they really have a grasp on that. So really looking at really clean numbers of how long with 3 units and what we're doing and how we're staffed. Are we on that verge of like, if we get one more call, we're in trouble, that kind of situation? I think that'd be valuable. So any questions for me? That is my report.
Any questions for Patty? Okay, I believe our ethics meeting is in September
Number 10.
on the 10th.
Mm-hmm.
And Abby, did you attend Foundation?
So there wasn't one.
Wasn't one this month?
So the next
It's
meeting
in
is September.
September.
That'll
Am
be
I on
September
those?
also. Sorry.
Yeah, I did not attend a meeting, but I don't think there was one. I saw the
It said
last
there
one, I
wasn't
think it's
one.
in September.
And Sean's not here, so Andrew, is there anything from the auxiliary we need to know?
You know, they had a tremendously successful bingo night last week.
Oh,
They worked really hard. It was their biggest night ever.
Really? Awesome.
this is the one at the ranch?
Yes.
Awesome. Good.
Also, they recently made 2 donations. I don't know if it's,
It's in the report, it's in that. Perfect.
Yeah.
We should highlight that, very good.
What does
Want me to
biggest
say
night
Big
ever mean?
donations, yeah.
The, keeping the food warm for the care center residents,
And then a treadmill,
and
right?
the treadmill for therapy.
13,000.
so every year they ask departments to request from them any items that didn't get covered in the budget that they would like. And they get the 2 items a year.
What does biggest night ever mean, like in terms of donations or number of people participating?
You know, they work so hard. They start about 6 in the morning and they bake. They get pies and baked goods, and then they put on a dinner, and then they have bingo, and so they made about $4,600. And they had about 145 people, so that was the most number of people and the largest amount of money. So they all look so tired. They work very hard.
They're a good place.
Thanks for that. I noted in the minutes that Sean was at the meeting, just unable to attend today to give a report, so. CEO report then. Dan?
Couple of highlights from my written report. Scott just let me know that today the organic days cash on hand is at 40 days. So we are really steadily climbing in the right direction with our reserves. So good news there.
So explain.
What's days cash on hand today?
40.
40.
Does that count like a short-term loan that you've got, or is that a
It's
legitimate?
organic.
That's a legitimate.
I did see that it said organic,
Yeah.
but it
So
seemed unreal.
Explain what you
So
mean by organic.
Well, so
it does seem crazy.
like we talked about, what we want to do is we want to show, we want to differentiate what cash is being generated from just the operations of the organization versus cash that comes in from either a working capital note or or the RHTP funds, grants, right?
Mhm.
And so the two numbers that we're going to show is what our combined actual days cash on hand is and what our organic days are.
So organic days are like 34 and unorganic is the 40.
No.
No,
It is
they
really
said it's
40.
really 40, yeah.
I'd have to hear it 3 times because it seems
We can tell it to you
Unreal.
4 times.
3, just 3 is fine.
Yeah. So, but obviously that kind of ebbs and flows.
Sure, I totally agree
But
with
but the ebbs and flows trajectory is on a good pace.
that.
And most of that, is obviously the hard work by the entire organization with the cost structure. And then on top of that is the revenue cycle. And that is the reason why we're recognizing Sarah and her team. Sarah's the leader, but she'll be the first to tell you that, without a good team, you just don't get things done. So you combine those two, and then the last several months obviously have been very busy for the organization from a volume standpoint, and it has been a little bit lighter on the Medicare mix, the payer mix, and all of those things have lined up for us to be able to move in the right direction.
And so what was the outcome of the short term?
So we ended up taking it. One of the things that we talked about with the finance committee is that, the concern is, do you need to spend that money, the interest, for that short-term borrowing. And Scott came up with a very creative idea, is if we do take the 2.5, I put in my CEO report that we're going to take that at a higher interest rate with T-bills. And so, our whole point is to be able to make money off of the money that we're borrowing and pay for the interest as we try to bridge the time that we're needing to, one, pay for initiatives that we know are going to pay off over time. And I shared with some of the finance committee the example of the Samaritan Fund. So we paid $500,000 to the Samaritan Fund so that throughout the year we can net about $1.9 million in savings. So that's a cash outlay that hits our days cash on hand, but you're not going to see the benefit until later, right? And so those are the types of things that we're trying to manage with this working capital note. There will be some, we don't know exactly when the RTP funds will come, but we do have a little bit of an update there that I'll get to here in a little bit. There are some smaller capital items that we need to manage. There are some contingencies that we're concerned about that we also want to be able to absorb if we have to. So if we don't need to use the money, we're not going to. And we want to hold ourselves accountable by showing the board that here's your organic days cash on hand, and here is your combined days cash on hand. I think once the RHTP funds come in, I don't think we're going to be using the often working note for a very long time.
But I saw Jeff's notes in that from Finance Committee. There is still the desire, will you still kind of separate what is the Rural Healthcare Transformation Funds? It does kind of set separate from like our working capital?
We could, if we wanted to just show the, 3 different buckets of where, what consists of our cash.
I don't know if it's possible. Did I read that correctly? It's hard to gather the whole meeting.
The desire of having essentially restricted cash that's sort of sitting there waiting to use for some of those purposes.
It's so hard because if I'm spending money and I know I have all of that to use and I'm using it, strategically, that's a hard thing to ask, but where we know that we only have it for a year, those funds deplete, I'd hate to see like, this is 4 days cash on hand, or, okay, we're at 80 days cash on hand, and then we're back to 20. That doesn't really tell a picture. So having a few buckets does seem to make sense.
Well,
we're keeping the doors open without that, but it's not a great situation. And that we inch that up and the progress is shown on our organic plan.
Yeah.
That's
well, one of the reasons, you take 2.2 million of that 4.7. That is for us to help with just strictly our EMS. And we have elected not to do anything with EMS right now.
no changes.
No changes.
Yeah.
And so if we're going to hold steady with EMS and EMS services, we're saying that 2.2 million is going to help us do that.
Yeah, I get that.
But it only buys us, again, 1 year at a time while we work with the community to figure out more of a sustainable solution. So again, all of this is, if we can hold on to those dollars and allow us to continue to move in a direction where we're building days cash on hand, that's what our intention and goal is. We want to make sure that Star Valley Health is in a position that can absorb blows financially for the long haul. That's priority number 1. Priority number 2 is meeting our bank covenants. We then have to consider, what other long-term capital assets we might need to either build, buy, or partner with in order for Star Valley Health to meet its obligations of providing access to care. But that's, I think, in the future. We've got to get we got to get in good standing with our banking stakeholders so that, we can share that positive story and move forward. So, the whole point is the organization is extraordinarily disciplined right now, and we're going to stay disciplined forever and ever and ever, because we also recognize and understand how fickle the payer mix can be to this organization. And so we always have to be on the move to improve the margin, but also increase revenue.
So then as we receive the 2.5 or whatever was short-term borrowing, are we putting that into a interest-bearing account then?
Yep.
While we're waiting?
Yeah, notes, T-bill notes.
Or you are putting it, how long?
6, 9, and 12 months. That's the ladder that will mature.
Those are what, less than 5%, right? Between 4 and 5?
But they exceed the amount that we're paying on the note. That's good.
That's really interesting. That is
Well,
creative.
And it's liquid.
But that's an annual rate, right?
Yeah.
Yeah.
So, but your fee was
50, right up front.
2.5,
right?
right, but that's not an annual fee because you're paying it back over 3 months or 4 months, whatever.
Fixed fee. So I want to exceed the fixed fee that I paid, the interest that we.
But if you were to annualize that based off of that, it's not 2 1/4, basically,
Like, give me the number, Mr. Mack.
Well, I'm just saying, if it goes over, how long does it go?
The fee was like $52,000, right?
So 4 months though, or repayment wise?
Doesn't matter. Because,
No,
so as long as this T-bill ladder over a year's time will earn more than that, I'm fine.
well, let me explain though. So you're saying 2 1/4% and your repayment on that is 4 months? How long are we repaying it over?
Depends on our.
We have a year. We have a year to pay it off.
What do you estimate though?
But it all depends on what comes in the bank account.
We've estimated that.
Yeah, so I think by the end of this calendar year, we will have
October, November.
So 6 months. Let's go 6 months.
no, so 4 months.
4 months.
4 months.
As I say, you're what you're talking about. So that's the 2 1/4%. You have use of that money for 4 months. So you don't have the full use of it for a year, so it's not an annualized rate. So the cost of 2 1/4% is you have to look at it, it's a third of a year essentially. So if you were to annualize that, you basically times it by 3. So I'm just saying 6.75% annualized. You're looking at an annual rate versus.
Well, then it would seem to me that you would hold the money longer
You would, well, that's the thing.
for the year, because then you get the 4 versus the 2.
And that's what we talked about. That's why we stretched
So-
out the last working capital note.
So we're borrowing at a less rate than we're gaining, depending on how long you keep it, is what I'm hearing. Is that
Well-
correct?
Not necessarily. So
Sure.
you have use of these funds for 4 months. Go ahead, Jeff.
No, we get them for a year if we want them. That's what I just heard.
Yeah, but if we
because
take
it's
the year to
paid
do
by
it, it's
revenue.
gonna cost us $150,000.
And how much revenue do you collect?
No, it's only 50.
No.
It's repaid back.
Do you have comments, Jeff?
I just think we're gonna get the option note anyway, so even if all you earned was a penny on this T-bill strategy, you've at least shaved off a penny from it. I mean, the math may be correct, but I think the principle is we're minimizing it through some type of a cash management strategy, which I think is a management decision. So I think for me, I'm satisfied with the approach and I'm ready to move on, but.
My point being is I just don't think that they look at it as.
You want to compare it?
I think you have to
No,
look
it's
at it as
not.
what Jeff just said.
Well, I don't disagree, you need to analyze it. So.
Because we're not actually,
We're not doing it to make money, we're doing it to minimize how much we're paying to use the money.
right, that's exactly it. because
And
we
what's
have these
the
funds in.
best strategy on that? Is it at getting it gone in 4 months or to stretch it out a year? That's all I want to
We
know.
don't,
Stretch it?
it is, but we don't have that option because we're at the mercy of whatever they are repayment how much ever revenue comes in, how much percentage they take.
Oh, that is one of those, you dump
So-
money into the kitty, they decide how much to
So
dump.
how much ever revenue
Yeah.
flows through Optum.
We recognize, so Clint's not wrong. I mean, Cole's not wrong, is if the cash comes into that account, it could actually be paid off sooner than 4 months. Right? And so, what we're saying is, we have access to $2.5 million. We don't know what the time frame is. We can estimate it, but what we wanted to adopt was a cash management strategy to offset any interest expense. Is it going to be $50,000 that we offset it? Maybe not. You know, there is going to be some type of cash out the door in order to have our CFO sleep at night, but we feel really good about where the organization is from a discipline standpoint financially, the trajectory of where the business is, how it's going, and us being able to bridge the time from now until when the RHTP funds come in, where we don't have to make use of the Optum note. But this is probably going to be the last time that we would use Optum for a while, and we elected to do it.
And so, any more on your report?
Okay, so
Any other follow-up questions? I didn't want to miss anybody, but yeah, I think.
then the other thing I just wanted to come back to was the RHCP. Mike had a conversation with a member of the Department of Health, and we believe that a portion of the funds can be quickly made available to us. Not all of it, but a portion of the funds. And the two requirements that we have to meet are an execution of a contract, and we have to verify, there has to be verification of meeting the CMS requirement. So once those two things are in place, the impression that we get from the state is that those funds will then be whatever category that the requirements that we meet, they will then release those funds. So as we get more information about the timing of the funding from RHTP, we'll keep you informed. That's the update. Mike, did I miss anything?
Okay. Other items?
That's it.
That's your report, your highlights. Anybody have any questions for Dan and the report he gave us?
When we operate at a certain level of days cash on hand, that we're not spending 52 to like have that cash flow in there, so it's more comfortable. There's like a sweet spot, like what's that number?
We're almost there. Yeah, we're almost there. I think if a rural hospital is in the 50 to 60 range, they're in a good spot.
Had you been in the 50 to 60 range, you wouldn't have.
I don't think so. No, we would not have touched it.
That actually is an interesting question, Abby. I'm wondering, theoretically, one of the reasons for having a higher base cash on hand is so you can absorb variations in the payer mix. And we used year-over-year comparisons on the payer mix, but have you done any analysis on what the monthly variability is on that, and to see what kind of maybe cash flow you like? I mean, your days cash on hand is pegged by the bank, but should it be something at least different for management to say, I need this much days cash on hand, regardless of what the bank says, I need this much to be able to absorb a standard deviation in payer mix? Have you done anything like that?
I don't know if we have.
In terms of an analysis internally?
Yeah, just
us from kind of the range of the bandwidth of our payer mix goes from here to here.
We just experienced it, so we kind of know. But
yeah, but I'm wondering, I'm thinking back in our finance committee meeting, we talked about how 1% can have the 250,000 consequence.
It seems like the difference of 5 days cash on hand right, $250,000, right? Or
A
$2.5
day,
million.
it's a little less than a day's cash on hand, but it could, 100 basis points shift in a month. Costs are up 250,000 in net
Yeah,
revenue / cash.
That's like less than a day.
Right,
that's a day.
but if you do that month over month by 6 months, right?
Yep.
Which we did last year from October through about March.
Yep.
So, our plan this year is built around a 49-day assumption average for the whole year.
49%.
49%.
Right.
Medicare.
And it's swinging within a percent or two of that.
Right, and in order for us to kind of maintain, if we will, and have enough to swing with the punches, or the checking the drive with the punches.
Yeah.
And, number one, we built in a heavy punch, 49% is a pretty high assumption, that's our plan. And it's about $2.3 million a week that we must clear in cash. And these last 7 weeks, we've averaged almost 2.7 a week. And, but that's because we've had a lower mix and a higher volume of services overall with our gross being high. So we continue to, from that way, we can build reserves just as quickly as they can go away, actually quicker.
Well, it sounds like in answer to Jeff's question, one, you haven't done any analysis specifically, but you have experience.
You understand.
And what I heard from Dan was his sweet spot was around 50 days.
I think if we're
Is
at,
data driven, but it's experience driven, right?
Right, and it's only, but it is data driven, but it's not.
But our covenant is.
Our covenant is, this year it'd be 60 days.
no, not this year.
Well, 2027 is 60 days, then 80 days next year, and 100 days. That's the current thing. They amended
Expectation.
it. It used to be just 100 period. Then they lowered it down and stepped it up again. There's, like Dan said, there's not many rural hospitals that have that steep of a covenant.
Yeah.
Very few, actually. So, we'll do our best. We never miss a payment. We haven't ever missed a payment. And we'll continue to show improvement toward, getting closer to it. We'd love to have 100 days cash on hand. I think we will, a year or so, maybe a year, 18 months.
I think any progress toward the bank covenant is important and necessary. That probably wasn't really what the basis of my question was. It was more just, we're all celebrating 40, which should be, that's awesome. But if we know that a typical variation in the payer mix can have a degree of swing on the sensitivity, is 40 or is 50, or is there some way of data calculating what you feel comfortable
I think the
with?
right thing to do is let me and Scott go back. Let's see if we can map that out and come back and we can agree on something.
Sure, there's a big one.
Yeah, Andrew, if you'll put that down as an action item for next month.
One other way to look at it.
Yeah.
What's
paying
that?
Cash on hand sensitivity.
One other way to look at it is to separate the hospital from the EMS. Becomes a non-issue. Because of the heavy subsidy we pay every single month after month, to maintain this highest quality of EMS services in the area, right? For the state, I think, right, Trevor? So you just take that out. If we had assistance, even to the degree we have any assistance on covering the subsidy, which we pay 100% of the losses of EMS, out of the hospital's pockets. We were to separate those out and say, what's our days cash on hand? Just looking at the hospital operation. Do the math. It's a lot higher. 10, 12 days. And that's just the nature of the beast that we have that we're dealing with. So these are our rural health funds coming to us will be used, rightly so, to cover that subsidy that we're paying every single month. We have been for years now. So we can do that well, you know, 'cause in the future, we hope to have some subsidy shared, the county or towns, or in another year with the transformation dollars, and then assist building stability of that operation. That's the biggest drain individually on the day's cash on hand is this $18,000 a day that we pay for the expenses. That's just another way to kind of look at the, you know, as things change. The mix with EMS is about the same from a payer standpoint, the hospital in general. So, but we'll do some more analysis. It'd be great to share that with you.
Other questions or comments for Dan?
So, Mr. Chair, if I may.
Cole?
So I did just a comment on there, and to Jeff's point, I think that's a really good analysis to do, but I think it's more than just the pair mix that we need to take into consideration. If you look back, I think you look back and see that a major hit to our days cash on hand was there every time we had an event, and I know we can't always plan for these events, but we need to make sure we have enough in the coffers to cover those, and whether, you know, I'm going to take the electronic medical record system. That was a major hit for our days cash on hand. You know, again, that was our choice to go into that, but that was a major hit. But there's other things out there that we couldn't control, uncontrollable variables. You know, when Change Healthcare went through their hack, that was a major hit. And I'm going to say overnight. I know it wasn't overnight, but within the first few months to our days cash on hand. And I know it's not anything we can plan for, but that's the point. We have to cover so that we're not taking over tomorrow because we didn't plan for the unforeseen. And so, along with what Jeff's talking about, I think that furthermore, there needs to be consideration given for those unforeseen variables as well.
I think that's very wise. I 100% agree with that because, you know, he just asked the bandwidth of the payer mix, right? What you're saying is the bandwidth of the other variables that we have to juggle. So maybe what we could do, you know, in our analysis is we can show you the size of those bandwidths of where, you know, what the risk exposure that the organization has or could potentially have, and really what that comfort level of days cash on hand should be.
Yeah, and I remember going back to, I don't know how many years ago this was, our conversation about just the environment, and yeah, we're glad we have not been hacked or anything like that, but
We should anticipate it.
There's lots-
And how many days cash on hand should we attribute to? Yeah.
Totally. Yeah. So and when, you know, when you think about it, you know, I don't call the conversation about 100 days cash on hand. I think everybody wants to be there, right? And because that is, what's that?
Nothing.
You don't want to be there?
I think it's an arbitrary number. I like this analysis.
Yeah. But
I've always thought it's an arbitrary number. I've always wondered what the good number is. I mean, every company would love to have 1,000 days cash on hand, but then it's just sitting there not doing anything. You're not investing it back in your company.
It's keeping the CFO and the CEO sleeping at night.
So I don't,
Keeping.
and I don't worry about people sleeping at night.
There's a
So
lot of things to it.
Yeah, so
I'm not talking about any thresholds necessarily. I'm saying that's something that, you know,
Yeah.
risk mitigation.
it's a litmus test to me of how well we're doing. That's what I look at.
But what I'm saying is I don't disagree with
And I don't either.
with
I think we ought to do the analysis.
with Cole's assessment
I
because
totally agree with that.
because we are independent. The risk sensitivity to this organization is a lot higher than being, you know, a system hospital. Right.
Definitely.
It's an interesting way to be decision-based. Like you say, oh, we're healthy, our organization's healthy, we're gonna take the plunge, we're gonna do this thing. And if you knew where our base cash on hand was at that point, we're making that decision, but we require contingency base cash on hand for the unexpected, even if things went awry. It's like,
It's great planning, great planning.
it's comfortable.
Yeah, I'm not disagreeing with that. Scott, you had a comment?
Cole, the hack that happened with Change Healthcare, hospice cash, they loaned us interest-free money for us almost as long, 9, 10 months is what before we paid us. Optum gave us money, just basically gave us, say, how much do you need to cover your shortfall till you're back up where you were? What really cost us money was the timely filing losses.
Yep.
Yes, basically, they stole, they stole them.
It was cheap for them to lend us that money because they knew on the back end we were gonna suffer.
The two
Yeah.
had nothing to do
That
with
happened.
each other.
Hey, all of the court said they didn't steal it, so.
The court dismissed it for still, and it's still an appeal, but Change Healthcare and Optum Bank is a great relationship. They have been very good to us, but they loaned us, almost $10 million, $9 million to, because they knew that the disruption with the cyber attack cost us cash. They covered us until we were back up where we were. It's the timely filing losses that they basically will never see that money. And it's a net of about.
No one wants it.
Right? We'll never see it again.
Still got a little hope.
Hey,
Well, I mean, never say never.
come on, man.
It's not, no negative vibes. You're
I
wrong.
think
Built
I
into
think
the assumption of the future.
We'll get into that in the executive session.
Right, okay, sorry.
Cole, do you have a
I would
comment?
argue that it is a combination of all of everything put together. And because there's just the timing and getting the funds and all that, you have to operate on something there's lost opportunity costs if you have to pull funds out of investments or costs there. And so my point being is there's a lot of events out there. We just need to be prepared. Number one thing you said number one a little bit earlier, the sustainability of the organization, that just falls in the category with that number one. So
We're on the same page. We're on the same page.
Okay, any other questions for Dan? I did want to pop back, Sean, Andrew gave a small report on the auxiliary. Thought I'd give you an opening to add anything that you might have. We saw the minutes, but.
They met me, had a big meeting, and I haven't actually heard.
We talked.
You guys got the highlights probably.
You got the highlights that it was the
Thank you for
best they've ever done.
best they've ever done. You guys are, I guess.
That's probably attributed to you attending the meeting, so we appreciate that.
I show up in the wrong colors and say stupid things else.
No.
Hey, did his donation get raffled?
Yes, it did. Yeah, it was very, very generous.
Does everybody know what
I read about one.
Sean donated? Sean, share with the board what you donated.
Fire, is that one here? The big
And
one?
I'm gonna tell everything.
Oh, it's just a fire pit. My students at the high school have found easy ways to make essentially quick, really kind of cool ornate fire pits. They're made out of heavy duty steel that weigh about 200 pounds, but they're fast. We forgot this process. They got a machine, cut all parts, and they just weld them together. So I purchased the metal and donated it to someone who wanted to build their own custom one. So I built a little baby one, and I guess Danielle made some little magnetic things that they could kind of have something for themselves. And I think Tamara ended up buying it.
Cool.
So,
Perfect.
yeah, so it was just a cool, quick donation. Just the high school kids will actually build it and donate it.
Yeah, we thank you very much. Will you let your class know how much we appreciate that?
For sure.
I think we ought to write them a letter or something.
They don't know that yet, so hold on.
Oh, okay.
We're just getting going.
I'm sorry, it was just announced.
If they're watching, they're
He
gonna.
didn't want a lot of.
Yeah, I don't appreciate that.
Oh, I didn't know that. I apologize. I apologize.
Well, play your trouble.
Principal's office. Okay, any other items? The EMS report is just informational, I gather. Just follow your CEO report in the packet. Can I get you to send me that on my regular email also, Andrew? And the letters that went to the town?
Did you already send that report out?
It's in your,
It's
in our
packet.
Oh, I read it. I have notes about it.
but I can print it for you.
I don't need to print it. I'm asking if that's sent out already.
It's available on the website, and we did share, we had a booth at the fair and we handed out several pamphlets that let people know about it.
How did that booth go? Why don't you stand up and give us a little report here? You know you weren't on the agenda.
So it went great. We talked to a lot of 11 to 14-year-old kids who wanted to spin the wheel, and a few adults, so. It was good.
Thank you. Okay, with that, I need a motion to go into executive session. Moved by Mindy. Second by Jeff. All those in favor?
Aye.
Any opposed? Okay. Ally, if you take care of the doors for us.